TB is an area where we feel very passionately and have a long track record of investing in research and development activities to support the TB response. As you know, we have ambitious targets for 2030, and we know that we won't meet those targets if we don't have a step change in action. Indeed, if we continue the way that we're going, about 28 million people will die of TB by 2030. We do need to do things differently. We need new tools, new approaches. And the meeting in September is really an important opportunity for us to put research on the political agenda. I think the message that we want to highlight at this meeting is that when we're thinking about research and development, we do need to think about a balanced portfolio of research investments. We clearly do need improved diagnostics and treatments, including for MDR-TB. But we also need applied research to tackle how we're going to achieve that step change in impact on TB and really deliver benefits to those most marginalized who are vulnerable to HIV and who might not access treatment. We need research to tell us how we can support health systems to deliver effective TB control. We need to be thinking about how do we effectively integrate responses to TB into the range of initiatives on universal health coverage, or get better at integrating TB responses into HIV programming. We need to be better at thinking about how do we meaningfully tackle factors such as poverty, stigma, and discrimination that may undermine our ability to deliver effective TB treatments to vulnerable people. The UK is a major funder of TB research, and in our work and investments in this area, we very much do try and have a balanced portfolio. We invest quite a lot in the development of new drugs and rapid diagnostics, but we also have a long history and continue to try and invest and support applied research because we do see those different parts of the research portfolio very much going hand in hand. And so for us, I think this panel, the point of this panel and the takeaway home message from this panel is that when we think about the messaging about research and development, we've got to put forward a clear message about technology. But also I think we run a risk, and we need to recognize the risk that we might not pay sufficient attention to the need also for applied research. To illustrate why we need that applied research, we have a great panel here for you to listen to, which will help you understand the various aspects of the applied research that we need to be thinking about and ensuring that there's sufficient support. Eloisa, you have survived TB, drug-resistant TB, but lost your eyesight and spent years of your life fighting the disease. Why is TB research important to you as a survivor? And what would you like to see accomplished by TB research to improve the lives of others affected by TB?
I remember being rushed to the more expensive hospital in the Philippines by an ambulance, and I heard all of my aunts surrounding me in the ambulance, and they're crying because they thought I'm already dead. Apparently, the disease wasn't permitting me to move at all, so I can't even close my ears because of the very eerie sound of the ambulance. I can't even tell them that I'm okay, I'm still alive. I can't even do that. But turns out it's because I was diagnosed after 2 weeks of waiting for the culture of the sputum. I went to 3 different hospitals and gave me wrong diagnosis. So I had a TB, the most severe TB meningitis back in 2007, where gene expert was not even introduced yet in my country, and at the same time, the doctors there are not TB accredited. Turns out that there's a pulmonary doctors, there's TB accredited doctors, and the doctors that's in the hospital near our residence had no updates regarding the Ministry of Health's guidelines. When I was rushed to a more expensive hospital, the doctors just gave me the first-line medication when the results came in, and I was able to wake up I was able to see, but after 3 days of coma, they told me that it's TB. We have to do the DOTS treatment. So they gave me the medications, and I started to lose my vision. They told me it's just the way it is. That's the guidelines. So it's as if they're not doing anything wrong when I was starting to lose my vision. And when I became 24 months MDR patient, they said that's the way it is. We're not responsible for what your body reacts to the treatment that the guidelines is providing. So it's as if nobody is getting any responsibility for what happened to me. So I believe there needs to be more research in that area for updating. The national government should at least look for ways to protect us. In terms of social protection, of course, I went totally blind, and I went to the National Tuberculosis Program, and they said that it's not part. Prevention of disability is not part. Disability rehabilitation is not part, and counseling is not their job. So I just cried to my parents, and of course, I have no more friends that time because they were having all of these stigma regarding the disease. So I went to the disability group, which is more established. They're federated. They have a law. They have budget from the government because they've been doing the UN meetings for how many years already. So that's the support that I got for what happened to me, but not in the tuberculosis field. I was very fortunate to be part of the WHO, or a regional green light committee in Western Pacific, and I raised those issues regarding social protection for the patients who go blind and deaf. And apparently, the most important person that I'm waiting to get an answer from said that, sorry, we don't know the disability law. So we don't know how to ask for disability prevention or to give social protection for those who result to disability because of treatment. So I just want to raise that issue that why aren't they researching local policies to support us? For me, I think I can still continue with this with what happened to me, but I just want to share to you that it's starting to scare me when it becomes an issue for my family. My dad, who's with me right now, actually had a symptomatic TB early this year. He went to one of the best doctors in the country, one of the oldest as well, who we believe has a medical eye, right? When he saw the X-ray of my dad, it said, probability. There's a probability. I'll give you the medication already. So when I heard about what happened, I said, you're not supposed to drink yet until you get a result in the gene expert. And then they even went and started to buy already the medication. So I asked my dad to go to the foundation that I'm helping out, and it was diagnosed properly that it's undetected, meaning it's latent. But why is it that these doctors are not updated as well with what we're doing internationally and what the guidelines are being given by the Ministry of Health? So it's just hard because the last time I saw my dad, he was just around 56 years old, and I don't know. When you're blind and you can't see your family, and then they're starting to sound weaker, they're starting to sound helpless. It's you really cry at night, you know. So for me, I just really want to make sure that I was able to reach out to all of you and improve the research, because maybe one day you'll tell me that because of what happened to me, I will have to expect Alzheimer's in the early years of my seniority, because that's what they told me. I still have abscess left in my brain. And maybe one day, I mean, I will still have a chance to see again, see my loved ones, and also see my daughter who's turning 5 at the end of the month. So I hope and pray that, things will be better. I'm able to do this, even if I can't design buildings anymore. At least I'm here. I'll take what I can do, and I'll just make sure that I'll be praying with the success of what everybody's trying to do with research on TB. So thank you.
Teresa, how can we as a collective community involved in the TB response move forward to accomplish the needed progress and ensure all, including the most vulnerable, can benefit?
Thank you very much, dear colleagues, for such an opportunity. It's really very difficult to talk after Eloisa after her story. I'm really very much excited by her story. And as a medical doctor, as a representative of the high burden country, I can't be untouched. I also feel fault for such situation, as maybe should be all of us, because it's really the miracle, this story, the miracle of the whole spectrum of problems that exist. It's not only the story of non-proper treatment, it's the story of non-proper organized prevention, it's the story of stigma, it's the story of huge gaps in research, and it's about TB in general. So I would like to tell that in spite of all these gaps and problems, catastrophic problems with which we face altogether, there is still hope. There is still hope, and I just came from the civil society hearing. You know very well they're organized today, and it's really very important chance, a unique chance to rise, to highlight the TB problem at the level of UN and attract much more attention to this problem. If we'll analyze TB story, it's really amazing story, a story of unique chance which we received more than 100 years ago when Koch opened mycobacteria, when the scientists, outstanding scientists, give us opportunity to protect, to prevent TB, when appeared BCG vaccine, when appeared some simple, but still effective opportunities to test, to diagnose TB. And now, since many, many years, decades, we're almost on the same stage. It's also a story within the unique chance, with a story of lost opportunities for decades. A story of gaps in finances, gaps in attention in research. We really lost a lot of time, and now we received mycobacteria, which become more stronger, and 600,000 people with a very strong disease, multi-drug resistance form of tuberculosis, for which we almost have no opportunities and modern instruments to treat. So it's really very sad story, but still it's the story of the last chance, last call. And we have now such an opportunity. If we'll not lose this chance, we'll really never win this infection. And we should do our best jointly. Of course, it's the responsibility, first of all, those who are making the decisions on the highest level, heads of states, ministers, financial structures, to provide necessary financing, huge financial gaps. But it's not only about finances. We should think how, in short-term perspective, try to use new opportunities, new international mechanisms to strengthen collaboration. And the very promising story of launched BRICS TB Research Network brings us hope. But at the same time, there are a lot of questions. How to organize this work? It's really very promising, but new mechanism. We should jointly think how to give the opportunity to the scientists, how provide necessary finances, and avoid bureaucratic instruments and mechanisms for pushing our activities, and receive as soon as possible new instruments, because patients can't wait for decades. Of course, the story of elimination is the story of vaccines, but as we see, vaccines will not appear in the short-term perspectives, but we should follow on, work on it. Meantime, we should do our best to help today and now to the patients who had TB.
Coming from a high burden HIV TB setting with very little or underfunded TB program, being in TB research is actually very challenging. I originally began as a clinician and worked for several years on the TB ward before almost naturally transitioning really to applied health research. So applied health research, here we are aiming really to to better fit the interventions that have been so aptly developed in the biomedical world to what is happening in the local context. And the aim of this is just to make sure that some of those solutions that are really good fit within the social, cultural, economic, and institutional environments that we have, and on how this influences our human behavior. In dealing with some of the challenges that we face when carrying out our applied health research, we do have evidence of what works. The problem is really how do we implement that evidence, especially in these low-resourced areas, especially in the global south, without testing how the implementation of that very apt scientific evidence is going to work out. Often, we know what to do. We know the numbers. We know what happens with TB. We know it's curable. But our problem is how do we get it done? And that might be what we don't easily know. We do have a challenge in terms of resources. Who is going to finance all the projects or the commitments that we have in terms of eliminating TB? Who is going to finance the human resource that is needed in our contexts to implement or effectively implement this evidence and the solutions? The priorities for applied health research, from my experience really, and from others who have worked in this field for a long time, is to develop solutions that are context-specific. And this is built on understanding the community in which we are working, the patients who come to us. How do we fit them into the innovations that we have developed? One thing, a very great lesson from my many years and for others who have worked in this field, I think, is listening to the frontline stakeholders, and that includes patients. We have just heard about our inability to listen can lead to so many consequences. So we have to incorporate their views in what we do in order for us to promote acceptance of solutions for the community. An example of some of the work we have been involved in Uganda is after the WHO announced that for low-income settings, they could go ahead and roll out contact investigation where we go to families to try and see who else in the household is affected. We did talk to family members and patients before we began. One great lesson we learned along the way is that the talking and engaging them does not end there. We found out why are we bringing the services closer to you. We are coming home. We want to test you for TB, test your family members. However, you are not accepting this intervention. It eventually became very clear from some patients who told us after receiving a diagnosis of TB and HIV, they need time. They do not need us to just barge into their household asking them to accept what we are telling them to do. Before we engaged with them, that is something that we would never know. So we have to incorporate the end users' perspectives. So we need community engagement, we need patient-centered activities and ways of doing things, and this is carried out, or this we can achieve through using applied science. I've already mentioned the finances, but it's cross-cutting really. Across everything we need to do in applied health science, who is going to pick up the tab to train people, to improve the availability of local resources, including mentorship, but also to develop local long-term agendas for applied health science. Those are some of the recommendations from my experience in working in implementation research and applied health science. And I think the greatest, I would think, is properly engaging with communities to develop solutions that are sustainable because they are acceptable to the people who are most affected by TB.
We have seen in this panel several different angles from this very important issue, from personal experiences to a more institutional response. What maybe would be interesting for me to do here is to try to highlight some aspects of this discussion related to the Brazilian experience. also. There are several interesting points that we could touch upon. For instance, the question of international coordination for fighting TB. Financing was an issue that was discussed by all speakers. Also, the involvement of civil society, which is extremely important, and naturally, the question related to the implementation of the 2030 agenda and how this all fits into this big scheme. On the question of the 2030 agenda, as we are getting ready to start the negotiation of the political declaration, we think that's very encouraging that we are gathered here today to discuss the role of research for TB elimination. This, of course, is an issue of utmost importance to achieving specifically target 3.3 of the 2030 agenda. Brazil, as a high burden country, is fully committed to scaling up TB prevention, diagnosis, treatment, and care. We of course, believe it's crucial and necessary to enhance investment in the full spectrum of TB research, from basic science to product development to operational research also. In 2017, last year, we launched our national plan for the end of tuberculosis, which comprises a Brazilian strategy for ending TB. This strategy is based on 3 pillars, including the intensification of research and innovation. The main objectives are: 1, to strengthen the integration of tuberculosis control programs with academic institutions and civil society; 2, to participate in the implementation of the priority tuberculosis research agenda at all levels of government; and 3, to encourage dissemination of research results. Then for our actions internally in the country related to TB and the implementation of the agenda. On civil society, one point that I would like to highlight here is the work done by the Brazilian Network of Tuberculosis Research, REDE-TB, which is an NGO that's concerned with assisting in the development of new drugs, new vaccines, new diagnostic tests, and new control strategies. Let me just touch a bit about the international level. Brazil is totally committed to enhancing collaboration and coordination of R&D with other countries, bilaterally, or through developing innovative financing mechanisms and new models of R&D, as in the case of UNITAID organization, which Brazil is one of the founding countries. As an example of cooperating initiatives in the international arena, I would like to also point out the G20 AMR, Research and Development Cooperation Hubs, which was mentioned here, and also mentioned the BRICS TB Research Network established in 2017, also a very powerful instrument to encourage scientific and technical cooperation among the 5 BRICS countries. I would like to state that we are the current chair of the Global Health and Foreign Policy Initiative for this year. We recall the importance of the General Assembly of the UN in terms of its annual resolutions as an important platform to promote the innovation in the health area. And finally, in accordance with the Moscow Declaration, we support the urgent expansion of multidisciplinary TB research and innovation, considering that the benefits of scientific innovation, especially as regards the health field, must be made equitable, accessible to all. In this regard, the international community, including not only governments, but also research organizations, donors, the scientific community, and civil society organizations must act together towards establishing a global strategy for TB research. And I'm sure that the upcoming high-level meeting will constitute a unique opportunity in this regard. Thank you.